Well, hello, everybody, and welcome back. So happy to see you all here and also to have a couple of great guests and hosts today for us to have a really great conversation about some really important issues going on in the industry right now. The first person I'd like to introduce today is Rich Rita. He's our VP of Business Development here at TechSource Partners and PAG. And also want to introduce a special guest today from a really great organization, Tim Bugg. And so wanted to welcome you both to the podcast today. Rich, you're an old veteran of our podcast, so we're going to let you get into the questions and maybe get Tim to give us some of the best answers he can pull out of his back pocket. So that's the goal today. So Rich, I'll go ahead and turn it over to you, and I know you've got some questions you'd love to ask Tim.
Well, thanks, Jason, for the introduction, and Tim, thanks for joining us. I'm really excited about this opportunity. Here at TechSource Partners and PAG, we've made a concerted, firm effort to help rural healthcare because we believe that rural healthcare is in a little bit of a distress, and our thought really went right to Tim, being the industry expert, probably the most knowledgeable person in rural healthcare that I know. And I just really wanted Tim to maybe kind of address with us, Tim, maybe, two or three top issues that you're seeing, because this is what Capstone does, is help rural healthcare. So if you can give us maybe the top two or three things that you're seeing impacting rural healthcare today.
Yeah, thanks, Rich. I thank you for the introduction and thank you for the opportunity to discuss it. I don't know that I'm the expert on rural healthcare, as you say. I think I know a lot about it. I think we are working hard to try to solve a lot of the problems. So first of all, for the folks listening, just to give a quick introduction around Capstone Health Alliance. So Capstone is a regional group purchasing organization that organizes and helps provide solutions around cost reduction in hospitals and non-health entities. So, and non-acute entities. So we operate today in about 24 states. We have about 125 or so health systems, about 250 hospitals, representing about 40,000 licensed beds and about $11 billion in annual spend. So we are a very large alliance. Of that alliance, we have about 52 members that we would consider to be in the rural market. And so when we define rural market, I think that's kind of the first thing that we need to talk about, Rich, is that rural market does not mean critical access, right? So sometimes those two get confused. Critical access hospitals, yes, are primarily in rural healthcare. However, you may have a 100-bed entity that is still a rural entity based on definition of rural healthcare. So in rural healthcare, you'll probably, if you were to Google it, you would probably get 5 or 6 different definitions of rural healthcare. But essentially, it is a healthcare facility that is servicing a rural community. And when you define rural community, obviously low income or low population, that type of thing. So what we have seen since the pandemic, if we really get into the guts of this thing, is that the margins of hospitals have declined drastically, as you can imagine. So we were on a decline pre-pandemic, but now the decline has been just a drastic change from the norm. So we are seeing most of our healthcare margins well below 1%, some even below 0. And that's even with the for-profits, who typically run a fairly healthy margin compared to other types or other nonprofits in the industry. So we're seeing that margin continue to decline because of reimbursement challenges, because of cost pressures, and a variety of other things. So imagine that if your local 700-bed health system is running a 1% margin, your rural healthcare provider is probably running a -2 or a -3% margin. So right out of the gate, revenue is a primary problem for our rural market. So many studies say that somewhere between 100 and 500 rural healthcare facilities are in danger of closing over the next 5 to 10 years. So when you talk about access, right, so that's the big pressure number 2, if you will, is access to healthcare. If we are really talking about equity and opportunity and access, which is what we always try to look at in healthcare, making sure that we're providing care across the spectrum, no matter what the color of your skin or the size of your pocketbook, that in rural markets, we are losing that access to care because of rural hospitals failing. And obviously, that's an issue. We are seeing many non-traditional players get into the market today, such as CVS, Dollar General, some of the insurance companies, and they are trying to tackle some of these problems, but they are not a full care center, right? They're primarily urgent cares, and urgent cares can't provide the same level of service as a hospital. So our access is going to change, and that is what scares me most, is that as we continue to see rural healthcare providers fail or close, that we lose access. The other side of that is that we are seeing some management companies and some larger systems that are going in to either manage these small rural hospitals or they are being acquired by larger systems. The trouble that can cause, there's a lot of positives to that. So let me start by saying that. Obviously, there's some parachute dollars that can be available. There's some investments that can happen into those facilities with capital dollars. But many times, because of the service level of those facilities, many services have to be turned away, right? So we have situations that we know of where things like childbirth is no longer a service in some of these rural facilities. And we're seeing some patients in our regions that are driving, 1 to 2 hours to give birth. Anything over about 30 minutes, I think, is probably too far. But we are seeing that that's happening as well. So when you're starting to lose service or you're losing the hospital altogether, both of those are really a lose-lose situation, right? We need to keep the hospitals open and being able to provide as much service level and as much care as they can. The third part, which we're seeing across the spectrum of healthcare, is this challenge with staffing, right? So since pandemic, we have seen a major decline in staffing, especially around the nursing capacity. So and when you have the option to go work in a rural setting, you really have to have a passion to work in rural healthcare to go there versus an urban system, right? So the pay rates are obviously different. The amount of technology is going to be different, right? So would you rather go work in the Cadillac or would you rather go work in the Yugo, right? So getting people into the rural market is a challenge, but that's not just in nursing. That's in physicians. That's in specialists. That's in CEOs, CFOs. So across the board, we're having these challenges with staffing in rural healthcare as well. So cost pressures, access, services, and now being able to staff it appropriately are really major challenges. The fourth challenge that I'll bring up is typically in our rural communities is where a lot of our chronic disease management is happening as well. So we typically have more, this is Tim Bugg opinion here. This is not stated fact, but in my opinion, I think we have more chronic disease in the rural areas and they require more care, right? So how do we continue to provide that rural health care, chronic care in these rural areas if we don't have facilities supporting care in rural areas? So again, I think it's a real challenge for this country and a real challenge for the people in leadership in healthcare today to continue to try to figure out how we keep rural healthcare facilities operational and open. And I wish, Rich, I had the answer to that. I wish we did. Unfortunately, we don't at this point. We're trying to tackle it, but we don't have the answer to this at current.
No, I think you've painted a picture that I think everyone needs to see. And I think we've seen in our 4-year relationship with Capstone the value that you bring. I think we're trying here at TechSource, we're trying to do the same thing and help because all cost savings and some of the smaller hospitals that we're working with. We got thank yous from the CFO saying, hey, we now can hire 2 more people. And what we're trying to do with Capstone right now and in the rural market is for any of your really small facilities, we're going to offer our services to upgrade their technology, their infrastructure, and try to save them money. And we're going to do that at 0 cost. Anything that we do is going to be on us, and all the savings benefits are going to go to your members. And what I thought you might be able to do is maybe give 1 or 2 examples on some of the things that Capstone is doing, your examples that you've done that have kind of helped address the problems you discussed.
So I think the challenge that we all have, and Rich, first of all, before I get into that, let me say thank you for doing that from TechSource's perspective, because it is without a doubt a needed service that you guys provide, and this is something that is really going to help our rural facilities. So thank you guys for bringing that to the market and really taking charge of that. At this year's annual meeting for Capstone, Rich, I think you were in the room. I challenged most of the suppliers in the room to really try to figure out ways to help the rural market. Because I think it's not a us and you problem. It is our problem that we have to solve, because all of us would be in a worse situation if we don't take care of our rural markets. So let me say this
100%.
right out of the gate. Finding forward in this problem is really, really hard because there are so many jump off points that finding the right one that's going to move the needle the most is the difficult thing, right? Is it payer contracts? Is it reduced cost? Is it staffing challenges? Is it access to specialists? What is it that's going to make the most impact in the rural market? So what Capstone has done and will continue to do is really try to survey our members and get some common themes where we think we can help facilitate, coordinate conversation to help better those markets. Since we've talked, Rich, we have begun conversations with our Rural Hospital Association here in our state to try to get more involved in that association. But let's look at the reality. So if you look at the American Hospital Association today, in discussions with them, I found that they have about a staff of 2 to 3 people that's working on rural healthcare today. In the Premier GPO, they have 2 or 3 people working on rural healthcare today. So it's the Rural Healthcare Association, which is our national association, is supposed to be the ones taking the lead, and I'm sure they're doing a phenomenal job. But I don't think their issues are rising to the top because we have so many other issues in major healthcare, right? So it's not that they're being ignored. It's just that they are not the burning platform right now as I think they should be. So it's a matter of how do we get more voice and how do we get more recognition into the rural market. And so that's where Capstone really wants to be able to take our position and be able to help advocate for those hospitals. We also believe that there's probably some very unique contracts that can be very beneficial to some of our smaller hospitals that are probably not beneficial to our larger ones. We also believe there's ways of looking at shared services, shared resources, things of that nature that could potentially help our members as well. But again, I can't say this enough. The problem has escalated so much that finding forward has become very difficult. And I think that anyone that you would talk to inside of rural healthcare would probably agree with that. It's where do you start, right? And where can you make the most noise and where can you make the most impact?
Right. No, I think those are great points, and I think you've also made an amazing point a minute ago. Sometimes it's not about the dollar value, and it's not about what can firms do to make money, whether it's Capstone or another vendor. It's what's the right thing to do for the country and for the health and for the citizens, because I have 4 kids, and you need to service these, have children and have healthcare accessible to everybody. And I think you made the point is a lot of people ignore the smaller operations because you can't make a lot of money. And I think at TechSource, we're taking it the other. We love big hospitals and we do business with a lot of IDNs, but we're really focused on the little guy because everyone else ignores them. So we think that your solutions, where you provide almost back office staffing in some instances for these hospitals because they can't hire them. And that's the thing that we're trying to say to hospitals. Well, they don't have the time to maybe do a full IT or telecom review. We'll do it for them. We'll do all the staffing. We'll be their back office. And I think that's the benefit. What drew us to Capstone was that's your value and that's your prop is you do all that heavy lifting for them. You do all that. And I just, like I said, I wish I had the solutions. I think, Capstone and Premier do a great job in doing this. But I wanted to, we've kind of painted a little bit of a bleak picture. Do you have one or two, maybe a positive, a win that you see that Capstone's been able to do that had a positive impact? Kind of leave everyone with a good feeling.
Yeah. And let me say up front, it is a bleak picture and you don't want it to be a bleak picture, right? I would love to come on any podcast and say, I've got great faith and that we're going to pull out of this hole, right? But I think, let me paint a few more things out there for you. So that's really interesting to me. I think the consumerism market of tomorrow is much different than the consumerism market of today. meaning that our younger generation is much more interested in accessing cost than they are loyalty to any particular entity. And so we're seeing that. We're seeing also this major move into outpatient care, right? So that's a major shift from inpatient care today. So most of my colleagues are very used to what we call heads and beds. And so when you take heads and beds out of the situation and now you're just really taking care of chronic care and emergency care, if you will, and disaster type care or trauma, then that's different than having someone have heart surgery and be in the hospital for 5 days. Now they're having heart surgery and they're in the hospital for 2 days, and then outpatient care takes over, and that's really where most of the care is provided. So I've said about 10 years ago that hospitals and health systems are really where the healing or the fixing's done, and healing is done in the outpatient market. And so I think that's obviously going to continue. The other thing that is fast looming is obviously this age wave. And so, we're seeing a mass of baby boomers continuing to retire. During COVID, we saw a mass of retirements that happened. The reality of it is there's not enough population in the workforce to support the population that's retiring. And so that economically is going to be a challenge for us as a country in the very near future because we're not dying at 75 years old anymore. We're living to be mid 80s and 90 years old. So when you look at Medicare use that's going to happen for 25, 30 years, that's a big bill that somebody's going to have to pay, right? So how is that going to be funded going forward? The other thing is that our healthcare spending is now over 18% of our GDP. For my entire career in healthcare, I've had this looming number of 20%. If healthcare spending gets to 20% of the GDP, what does that mean? And I guarantee you that at some point, when you have, obviously federally funded funds coming into healthcare, CMS, that if the government feels like us as providers can't handle the business, they will take the business over in some way. So we've got to be very careful of that as well. So we've got to get our hands around the entire healthcare spectrum right now, including rural healthcare, to make sure that we're making positive strides forward in being as creative as we can. So a couple of things I would challenge all podcast listeners to, and I challenge everybody to it all the time, is being more creative in your thinking and being more entrepreneurial in your thinking. Traditional systems are great, but I don't think we're in a traditional setting anymore. And I think we saw a lot of creativity and a lot of entrepreneurism coming out during COVID. And unfortunately, I think some of that is now staled. I'll be honest with you, we had healthcare leaders that were, working 16 hours a day through COVID. And it was a nightmare, and they're still very, very tired. And so
Yeah.
I want those creative juices to continue, and I hope they will. So the positives I think that are out of this is that we have got some great young minds coming into the healthcare community. And I think us old birds like me have got to really embrace those great young minds and let them think and let them do, right? We can't straddle their creativity because it doesn't fit our norm of 35 years ago, right? We've got to let them think out and let them try
Right.
new things because I think that's how we will solve the rural healthcare paradigms. I think rural healthcare is going to have to be really open to some change. I think their business model is different, and I think they're going to have to understand that they will have to provide healthcare in a different way than traditional hospital settings. And I think we're seeing some of that now. There are situations in the country where we've modified into these super ERs, if you will. And I think those could be the right situations for certain areas.
Mm-hmm.
But I do believe other areas, depending on population and disease state, would probably need to be a different kind of care provider. So a more comprehensive care provider, if you will. So that being said, I think we are doing
Right.
what we can, Rich, and I think that there are a lot of people working on this at this point in time, and I do see positives coming out. I just don't know that we're moving as quick as we can. And I think, healthcare traditionally runs about 10 years behind modern industry on everything. I think we've got to catch up in our healthcare thinking. We've got to make change quicker. And you will hear me say a lot of times to my team and to our members, it's time to change the game. And I've been preaching that for about 8 years now, that we've got to, change the game. And if we don't change the game's going to change us. And I think we got to be ahead of that. So positives to me is great young minds.
No,
People are already working on it. I think Capstone will continue to work. We'll continue to do what we can to help our rural providers survive. That's what we want to do. And we will be, really trying to figure out what those items are that we can take forward.
I appreciate your insight and your time, Tim, and I think you made a couple of valid points right in there. And I think the younger minds are the key. And I think we just worked with a very small facility that we weren't able to save them money, but their technology was so old, we were able to upgrade their technology and increase their bandwidth by over four times, which helped them reach more people. And I think those are the minds that they were like, what can you do? How can I get in front of more people? And it wasn't a cost saving thing. It was for the same dollar amount, but now they have a better experience and they can help their patients better. And I think the younger people understand technology is going to be the key. Older people like, maybe you and I, technology kind of scares some people, but technology is, you got to embrace it. And it can be a great ally. And that's what we're trying to do at TechSource, and that's why we've partnered with you guys at Capstone for the last 4 years. And again, I just want to thank you for taking the time and for your insights and for your partnership. We really love working with Capstone and Premier. They've been great partners for 4 years, and we continue to work with you guys, and we hope it'll be a long relationship. And I hope this is not the last of the podcast we do, and hopefully the next one will have some good successes, and hopefully the world will be a little bit better. But I do want to thank you again for your time.
Absolutely. And thank you guys for giving me the opportunity. We would love to do another one, Rich. We'd love to talk about successes in a little more positive note. But I do thank you for helping us sound the alarm around rural healthcare, because it needed to be sounded. So thank you.
Great.
Agreed.
Thanks, Jason.
So Tim, thank you so much for joining us today. Super insightful. Obviously, your experience and the expertise that you bring to the industry, is something that's very valuable. And, kudos to TechSource and your organization to try to make an impact and try to do something different to, increase awareness, allow people that are in those markets to really have a voice, which they don't currently have, and to try to get the message out. So great conversation today, great topic. Definitely needs to continue to be talked about and continue to be worked on. So appreciate both of you being here with us today.
Yep.
And looking forward to the next topic. And Tim, don't be a stranger. We'll have you on here maybe in the next year again. And to Rich's point, maybe we can talk about some of the successes we've had in working with different organizations, and maybe even bring on one of those administrators or executives from those rural hospitals and really have some conversation about what they've seen and maybe some positive changes that have happened. So really appreciate your time, appreciate all the effort, and we look forward to seeing you on the next TechSource podcast. Thanks for joining us.
Take care.
Take care. Thank you.